Hi folks, I am Dr. Jaswinder Singh Saluja, Senior Consultant, Department of ENT Head and Neck Surgery at Apollo Hospital, Jubilee Hills, Hyderabad. Today I will be sharing information regarding a very common ear complaint, tinnitus. Some of you may be aware of it that tinnitus is a perception of sound or noise in one or both the ears. Every day we see at least one patient. It is basically common in out of 10 patients, one is having tinnitus. Now, what causes this tinnitus? Tinnitus happens when there is wax in the external auditory canal, or it can happen in more complex diseases of the middle ear, such as tympanic membrane perforation, or middle ear effusion, or ossicular discontinuity, or otosclerosis. Sometimes it can happen in disease of the inner ear also. And very rarely it happens when it involves the central nervous system. Tinnitus is one of a common finding. Now, what are the types of tinnitus? Tinnitus is like subjective and it is very common. Majority of the patients have this. Like a person hears this abnormal noise. It could be in the form of a ringing noise, or it can be in the form of a buzzing noise. The presentation varies. Now, what are the treatment available for this tinnitus? Now, it depends on the reason or the cause of the tinnitus. Usually, tinnitus is not a disease, it's a symptom. So, once we find out what is the reason for the tinnitus, we have to treat that. Basically, if the problem is in the external ear, we treat that. If there is a problem in the middle ear, we have to go for a audiogram. Sometimes we have to do a CT scan or MRI of the brain to check the reason for the tinnitus. Some people may have tinnitus because of hearing loss, like nerve deafness. Such people will require hearing aid to get rid of the sound. But some people can have tinnitus without hearing loss. Such patients, they will require some maskers that can be used as maskers are wearable devices, something like hearing aid. They'll generate sound intermittently so that the tinnitus is inhibited in them. But some people have this problem more in the night, especially when there is everything surrounding is quiet. So such people can use tabletop sound generators, which will produce natural sounds as waves or water flowing. That will give them relief to some extent. But in some people, it's intractable. They face a lot of psychological issues like fatigue and depression. Such people will require tranquilizers or sedatives. Some people may require antidepressants or anxiolytic treatment. Latest, there are some devices also which can help in taking care of the tinnitus, such as acoustic neural stimulator devices. These devices are like small palm-size device which generate broadband frequencies which are embedded in music to mask the tinnitus. So it is actually very simple to treat, but in some patients they require counseling. So if you face this problem, please consult your ENT surgeon. Folks, you can reach me out for your ENT complaints or ENT problems at Apollo Hospital, Jubilee Hills. You can connect directly with the hospital, or you can use one of the Apollo apps to reach out to me. Thank you.